Greetings, my name is Dr. Eric Joseph. I'm a facial plastic surgeon and adult otolaryngologist practicing in West Orange, New Jersey. We've been in solo private practice for 14 years. When I started in private practice in 1999, the majority of my referrals were sent to me from either primary care doctors or from other specialists. Today, things are quite different in several regards. One, the majority of our practice is focused around facial plastic surgery as opposed to being primarily focused on otolaryngology. And we're also a third-party free practice, which has been a slow transition over the last 3.5 years. 90% or more of our patients end up finding us on the internet. At least right now, the internet is a blessing because it ends up reaching a much larger catchment area. We get patients from all over the United States of America and even internationally. The challenge of the internet, the challenge that a physician faces when dealing the internet is controlling it. Anybody who's watching this video that's a physician, if you haven't put your name into a search engine and Googled it, you should do it, because you'll end up seeing right away on the first page and the second page that your name in physician rating sites is going to come up. If you have a disgruntled patient or an unhappy patient, they are very likely to broadcast their negative experience over multiple physician rating sites, and sometimes reputable physicians can have their reputations tarnished and dominated by a small minority of patients who are unhappy. My experience has also been that happy patients, unless if it's made easy for them, your happy patients are unlikely or less likely to spontaneously go to the internet and opine about their wonderful experience that they had with you. So what eMerit has been able to help us with is enabling us to capture this happiness at the point of service while they're in the office at checkout. Those reviews and comments, having them populated on the multiple physician rating sites that exist today, has really been a blessing because it's been able to put a fair perspective and a fair analysis of what my actual patients actually experience when they leave my practice, as opposed to the whole narrative being dominated by the disgruntled few or the fraudulent and fictitious posts. Once you implement it into your practice, it just sort of takes over on its own, and the internet just starts populating with what your actual patients are saying. They hear because they read the reviews that our patients have expressed, and they're here because they see the before and after pictures that I've posted on the internet. And it's really the combination of internet reviews, before and after photos, and just the knowledge that you're able to disseminate these days on the internet. You get less stressed out by the fraudulent post, which I've seen multiple times, and you get less stressed out by the occasional discontented apple that you just can't make happy no matter what you do, because there's a continual stream of your own actual patients that keep populating the sites, and that I think is priceless.